Understanding transverse lie and delivery options.
Hello and welcome everyone. Today, we're discussing a specific fetal position known as the transverse lie, and the various options available for delivery in this scenario, as well as potential risks associated. A transverse lie means that the baby is positioned sideways in the uterus, which is not the typical head-down position.
What is a transverse lie?
A transverse lie is when the baby is lying horizontally across the uterus, with its head to one side and its legs to the other. It's a position that occurs in less than 1% of pregnancies at term. Typically, babies tend to turn and settle into a head-down position by the time of delivery. However, sometimes they remain in the transverse lie.
What are the delivery options?
Given the baby's orientation, a vaginal birth might not be safe, so let's look at the options. 1. External cephalic version, ECV. This is a procedure where a trained doctor tries to manually turn the baby into a head-down position from the outside of the belly. This increases the chances of having a vaginal delivery. 2. Scheduled cesarean section. If ECV isn't successful or appropriate, or if the baby remains in a transverse lie, a cesarean section is usually recommended. This is where the baby is delivered through a surgical incision in the mother's abdomen.
Are there risks or complications?
Yes, as with any medical procedure or situation, there are potential risks. 1. ECV risks. There's a chance the baby might not turn, or that turning the baby could lead to problems like a drop in the baby's heart rate. In rare cases, it could also cause the umbilical cord to become compressed or the placenta to separate from the uterine wall. 2. Cesarean section risks. Cesarean deliveries, while generally safe, come with risks such as infection, bleeding, and longer recovery times. There are also considerations for future pregnancies after having a cesarean. 3. Risks of waiting for natural labor. If a baby is still in transverse lie and labor starts naturally, there's a risk of cord prolapse. This is when the umbilical cord drops through the cervix before the baby does, which can compress the cord and reduce the baby's oxygen supply. In summary, while a transverse lie is uncommon, it's essential to be informed about the delivery options and associated risks. Your healthcare provider can guide you in making the best decision based on your individual circumstances. Thanks for watching, and we hope this information has been helpful to you.